Yeah, amazing. Hi, everyone, and welcome to the Jasiri Network LinkedIn Live podcast session. My name is Nancy, and I'm the founder of Jasiri Network. Today, I'm joined by a very special guest, Dr. Moka Lantum, founder and CEO of CheckUps COVA. Dr. Moka is a qualified medical doctor, holds a master's degree in healthcare management from the Harvard School of Public Health, and a PhD in pharmacology and toxicology from the University of Rochester. So not only is he a medical doctor, he also holds a PhD because it was like, hey, you can't study enough. Dr. Moka is a visionary in health tech, building solutions that are transforming healthcare delivery in Africa. The last time that I spoke with Dr. Moka, he was in London for the London Tech Week, and hopefully, we'll dive a little bit into that. But for today, we're going to discuss a little bit of what he's doing in the healthcare access space, and some of the interesting products and services that he's kind of rolling out with CheckUps COVA. Welcome to the live, Dr. Moka. Where are you joining us from?
Hi, Nancy, and really delighted to be on the Jasiri Network show, if I may call it, live from New York, uh, and certainly not from Unga, live from New York, but not from Unga.
Yeah.
And really delighted to be here. Uh, what you're doing is amazing, trying to tell the stories of those who are on the front lines trying to shape a narrative. We all dream of making change happen in Africa, and it's our generation that has to do that hard work. And so you sort of bring us together and enabling thought leaders to share sort of what they're doing. I think it's an amazing contribution to the ecosystem. So thank you, and delighted to be on your show.
Thank you, doctor. And I know, it's around 6:30 a.m. in New York. So thank you again for making the time so early in the morning.
Thank you.
Yeah, and just, to start off the day, we're going to have a quick fire round, five quick questions to kick us off. So first question, are you ready, Doc?
Let's do it.
So the first question, if you had to describe your life journey in one word, what would it be?
Resilience.
That's a great one. What's the most surprising thing about growing up in Cameroon that shaped who you are today? Because you grew up in Cameroon, but then moved around a little bit.
The lack of or the deep underappreciation for um, power and misuse of public resources. I grew up
Mm-hmm.
in a neighborhood where everybody was pretty privileged, and I got firsthand to see how you know the families of those who have access to state resources, how they kind of misuse it. So that left an imprint on me as a child.
Okay. Okay. Which city in the world has influenced your outlook on healthcare the most and why?
Uppsala, Sweden, where I
Mm-hmm.
studied for 2 years, certainly gave me a very clean look at what a good healthcare system could look like.
Mm, okay. Fourth question. What's one misconception people have about medical doctors that you wish you could change? I'll go fast because I wanted to become a doctor when I was growing up. I thought being a doctor is the most noble thing somebody could do. I still do, but hey. So what's one misconception people have about medical doctors?
It's noble. I think the misconception is that because you're a doctor, so you're a high net worth individual. Uh,
Okay.
many of the doctors are just are struggling to make ends meet because of the healthcare system. Either in many cases they are underpaid to do what it is that they do, and healthcare has been looked at in the name of nobility as something that you kind of do not discuss the financial returns. You just do what you have to do. That has been the tradition. So health and money were running on parallel tracks for a long time. But now reality is setting in. And so you see certain markets, the doctors are demanding very, very high salaries, and the health systems now are forced to catch up. And I think that is part of the challenge that we see in the Africa market.
Yeah, true, true. I don't think actually doctors are paid enough for the amount of work they do. Because, like I say, like the amount of work, the amount of giving to other people on a daily basis for long hours, you're literally bringing in life into this world and sometimes supporting people as they transition out of this world. Again, it's very noble. I didn't end up doing medicine because I'm very empathetic as a person, especially when somebody's sick. And I couldn't, even as a small child, I think for me, hospitals were very intense places. And I was even scared of going to hospitals. I was like, there's no way I can even, be somebody's doctors. Otherwise, I'll be crying with them. I think that's not a very good look for a doctor. Anyway, last question. If you want a doctor, what other career path would you have chosen?
Investment banking.
That's a surprise. It's very opposite to medical doctors.
Until you peel the layers of the onion,
Mm,
which we
okay,
shall on this show.
fantastic. And that's it. That's the quick fire round. I hope it's been a nice quick one to get us in the flow of things. And as we kind of start this discussion, I know I mentioned like Cameroon. Oh, you've also mentioned Sweden, and you've mentioned right now you're currently in New York. But let's start with your story, kind of like growing up in Cameroon. You moving to Sweden, and then to the U.S., and then somehow finding yourself in Kenya. But take us back to you being in Cameroon and deciding how you want to sort of take up be in the medical field and become a doctor. Like, how did that whole journey go from Cameroon to Sweden to the US and now to Kenya and still New York?
Life is a blur, and it's a tale told by an idiot, full of sound and fury, signifying nothing.
Mm-hmm.
The tale of life is you believe you would go one way, but life takes you the other way. And the journey is one that we must embrace at every turn. They growing up in a household where my dad was one of the preeminent physicians in the country, and was actually one of the founding members of the Faculty of Medicine. You understood very clearly the impetus of having a strong healthcare system, and so quite engaged. I think what he did very well was to engage us in his work. So his career and his professional undertakings were not were quite proximal to sort of what we did at home, right? Either helping him with his exams or meeting his other students, the other fellow medical students. So I got to know a lot of the doctors even get before getting into medical school, right? So in Cameroon, I can easily walk into any facility and I know from the top to the middle management personally, right?
Yeah.
So my mother was the dean of the School of Education. She was one of the first female founding deans
Mm-hmm.
in the School of Education. Was one of the first principals to take over a public primary school in Western Cameroon in the 1960s, and so she brought a very acute sense of urgency back in the day around the girl child,
Mm.
women's rights. And so having two towering parents with two towering careers, I would say something that influenced me in a very fundamental way. So I don't.
Positively or negatively? Because it can go both ways, right? Some people kind of crumble under the weight of such strong, enigmatic parents. But you seems to have gone the other way, where it has such positive impact on you.
It has positively in every shape, right? Well, thing about things about life is, anything that's too positive also could be negative, right? So uh, I would say positive, very strongly positive, which may also have its a negative streak, if you will, in the sense that I'm not the kind of what you call frou-frou guy. I don't do small talk, right?
Mm-hmm.
I'm about business, and it's about let us. We don't have too much time. There's so much that needs to be done, right? And so that may come off. Sometimes I may come off as cold because I'm just trying to understand what's this conversation about. But because both parents, our conversations were always substantive. I never did small talk with my dad, and I never did do small talk with my mother. Right? It's about there's this problem to be solved. How we're going to go about it, and who do we need to call? Who do we need to mobilize? And she is 86 now. My mother. My
Mm-hmm.
dad would have turned 92 last week.
Wow.
Um, and the conversations with her are just what are we going to do next, right? And so it's a blessing, but also one that comes with enormous responsibility.
Too much. Because I know what it means to have such kind of parents, and even not sometimes, not even parents, even siblings
Yeah.
sometimes, because it's just like you also want to carve your own space and your own path. But okay, so you got that influence from your parents, very strong, in the medical field, very strong in the academic field, and then you chose, becoming a doctor as your path as well.
Yeah, yeah. Well, the context of the times where if you a good student, you looked at the the professional institutions, engineering, medicine. We didn't look at administration as an option. We didn't look. Finance was one of those things that was not sort of like uh, very common. I remember one family friend, the dad was a chartered accountant, and I never could understand what is a chartered accountant. What does that word mean? Right? The other one was a banker. They're like, okay, what does that mean? Doctor, we could understand what that meant. Teacher, we know what that meant. Engineer, we know what that meant. It was proximal to the activities of the home. Either you're sick, something needed to be fixed, you needed to go to school. Banker, it's like, I don't have money at that age, so I don't know what it means to have money. And hell alone, accounting, we didn't, our parents were not running businesses. So a chartered accountant was somebody who worked with a big company in some back room. So we didn't know what that career option was. It's now in later life that we realize that wow, those are actually very influential careers in finance, careers understanding how money moves in society, right, is a very important role. Um, uh, Almost as important, if you will, as understanding how the spiritual realm works, and also understanding how the healthcare works or how education works. So I would say that there is a gross underappreciation for what those careers could were, and so we tended to lean towards the national institutes where all the competitive students went, and so competing for medicine and engineering was my portion, and one that I pursued aggressively and made it.
Amazing, amazing. And so how did you find yourself in Sweden? And how long was your Sweden stop?
Actually, that was a complete fluke, huh? Complete entirely fluke. There was no. Uh, it happened that in my dad asked me to do a project for him as he was a consultant for WHO and also was consulting for WHO at the time, and he had a project to um, monitor at the national level the level of iodized salt. Iodized salt low in the diet causes goiters. So he said, hey, for your summer project, can you collect, help me collect samples of iodine in kitchens in the country? And so he gave me this amount of work, but also a lot of cash. I just remember I had a lot of cash on me. And I went around the country walking into somebody's kitchen. I walk into your kitchen. Hi, Nancy. My name is Moka. I'm from Yaoundé. And I need your salt from your kitchen. Can I test your salt for iodine? And I was like, what the heck are you doing in my kitchen?
Yeah.
And literally, I had to go to high-end houses, low-end houses, went throughout the national territory. So I've had the privilege of visiting almost every major city in Cameroon or a division because we wanted to have national representative data. It was 6 weeks on the road backpacking. And so I collected that information, which became an invaluable resource. So we published at the time, I was 21 years old, no, actually 19 years old, 19 years old. We published the first mapping of iodized salt in Cameroon with my dad. That's
That's
wild,
kind
right?
of cool, you know. That's
So,
really cool.
yeah. And so when we published that, it turns out that the story was published in the WHO bulletin, an excerpt. And one professor at University of Uppsala, Professor Hans Rosling, excuse me, Hans Rosling, read the article and he said, "I'd like to meet that young guy. That's the kind of, those are the kinds of students we really need in our program." And I literally uh, got a letter. That letter happened to come on my birthday. Now, here is the narrative, Nancy. I'll take just 1 minute to explain the narrative so you understand how really life is a curveball.
Mm-hmm.
So, December 20th is my birthday. I'm
Mm-hmm.
literally sitting, laying down on the sofa in the living room. My dad comes back from work and says, "Hey, what are you doing for your birthday?" I said, "I'm not sure, but I don't have any money." And he looks at me, he laughs, and he understands indirectly I'm asking him for pocket change to go drink with my friends. And so he hands over this letter to me from his office because it was addressed to his office. And so I literally take the letter from Sweden. I didn't even look at it, and I put it under the pillows, lips lying down on in the living room, and I kept on sleeping. So I sleeping as a young guy. We always sleep. So it's 4 o'clock in the afternoon, 9 o'clock at night. He says, "What have you looked at that letter?" I was like, "What letter?" He's like, "I gave you a letter." "Oh yeah, I put it under the pillow." So I open it, and it's an invitation with a full scholarship to come to Sweden to
Wow.
study, and with a deadline of February 14 thereabout, somewhere there.
Mm-hmm.
So literally I had now 8 weeks to make up my mind. Am I going to take the scholarship? What's
Yeah.
going to happen? I now had to go apply to my medical school for a leave of absence. And next thing, I was in Sweden, landed there in February, the peak of winter, and I became literally on that day a part of the global health community.
Wow, that's amazing. Okay, I think let's start with how amazing it was your father including you in that study, and not just including you to do the the heavy lifting of the footwork for you, but also kind of like acknowledging you in the publication. I think that's amazing, you know.
Uh, that was really, I mean, that it was good fortune, right? That at that age, I got a chance to be mentioned in a major international publication, right?
Yeah,
So
yeah.
again, those are not things which I take for granted because he was conscious about it. He understood the power of publishing at the time,
Mm-hmm.
and he
Mm-hmm.
made sure that at least one of his sons was published.
That's amazing. And then also you mentioned were you already in university in Cameroon? Because I think you mentioned you applied for leave of absence.
Yeah, I was already in medical school. I was in my third year in medical school,
Wow.
so that was quite yeah, that was quite something
Yeah,
because
it's not an easy decision to make.
yeah, I had to now apply for what do you call it, credit, so that the
Mm-hmm.
work I did in Sweden would count for my credits back in the university in Cameroon. It had
Nice.
never been done, so it
Mm-hmm.
required a lot of getting a lot of approvals from the
Mm-hmm.
deans and from the chancellor of the university, which were fortunately granted. And it turns out that the work I did became a landmark study identifying the first cases of a disease in Cameroon, right?
Yeah.
Konzo is the name of the disease. which was associated with cassava when people eat cassava during the dry season.
Mm-hmm.
And then the cassava destroys their central nervous system. These kids become paralyzed. It affects kids in rural areas, and they're playing and they get paralyzed. And you think it's a polio outbreak, but it was a toxin coming from the cassava. So the work I did with the team in Sweden with Hans Rosling, also another professor, Torkil Tylesker, and a nutritionist, Lindley Chiwona from Malawi. So those are the team that were supporting me in the work. And so we described the cases in Cameroon, which is became my thesis for medical school. And yeah, it was literally a major contribution to the public health agenda in the country.
That's amazing. That's such a powerful story. Powerful on all fronts. Powerful from, a mentorship, a sort of angle with your father, and even the family sort of, importance of that. You taking a chance as well. You going out there to Sweden at so young. I can't even imagine. And then you also being part of the study and sort of like with Cameroon and working with other people from different nations. So that's amazing. And well, still with the story about Sweden, so how long were you in Sweden and how did that sort of whole change um affect you, whether positively or negatively? Because you're moving in February, it's so cold at that time, and you're coming from Cameroon, which I'm assuming is better weather, and being so far away from family as well.
Well, Nancy, I can tell you that going from Cameroon to Sweden in February is like going from how can I put it, ambient temperature into a freezer, like literally, literally into a freezer,
Yeah,
where you have no context of what cold feels like, right? So I arrived with a cardigan, a sweater, and
biggest mistake.
biggest mistake. And long story short, I would spare you the details, but I had a frostbite,
Oh
which
wow.
I didn't know what it was, and and I had to be taken to the thrift shop where
Yeah.
they sold second-hand goods, and that is how I got my first winter clothes, thanks to my supervisor at the time, Torkild. And then later on, I got the winter blues. I didn't know what
Mm-hmm.
it meant, and I started painting, and that really got me into art. So I became a
Mm-hmm.
good painter
Mm-hmm.
in the peak of winter. And but then also I sort of discovered a side about myself, about the arts, which was a good thing. And but in that process, I also made the very amazing friends. I'm not in touch with most of them. I lost
Mm-hmm.
contact, but certainly it was an I would say discovery of self
Yeah.
in a context where there was nothing that was familiar.
Yeah.
Everything was new. And
Everything. And you're so young at such formative years, like 2021.
yeah, the food
Wow.
was new, the weather was new,
Yeah.
the language was new, the culture was new. Learning in such an academic environment was new. And so really, I am so grateful for for the experience I had in Sweden because it grounded me in
Mm-hmm.
terms of being able to understand certain fundamental elements of science,
Yeah.
and which I apply today in every work by virtue of the exposure I had. But most importantly, one of the lessons I learned, first lesson for our talk today is chance favors the most prepared.
Mm.
And really working with Hans Rosling, he had that on his computer. He said, chance favors the most prepared. So mine is to prepare you so that when chance comes, you know you can embrace chance and run with it.
And you're
And
ready.
yeah,
Yeah.
and
Amazing.
chance came. I got a grant of $500,000 at that young age to study the disease in Cameroon.
Mm-hmm.
So I was rolling in cash as a young man with $500,000 in my to my name.
Yeah.
But it allowed us to do the research in Cameroon with the team,
Mm-hmm.
and in that process, I discovered that the team in Sweden was very good at the epidemiology, understanding the
Mm-hmm.
nutritional aspects. I was really wanting to understand the scientific molecular aspects of how the cyanide from cassava was destroying the brain. So I got a scholarship now to go to the University of Rochester, where I did now my PhD in pharmacology just shortly after finishing med school. So it was really in tandem, and that's sort of how it happened.
Yeah.
And had the good fortune of working in the best, one of the two, three top labs in the U.S. On what you call neurotoxicology and how the body converts certain chemicals to other chemicals that could be very destructive to the body. And my thesis, if you look at it online, is kind of a
I
mouthful.
saw, I did go online and saw a couple of publications actually, which is impressive.
Yeah, it was a good run. I got 13 publications for my PhD, and in top tier one, tier two journals, peer reviewed. Which again, right, looking at it in hindsight, was all real good to be grounded. Uh, but what that did for me was it put me on the limelight to be recruited by Kodak. So
Mm,
from there, literally hired by Kodak, because the work I did became very fundamental for industrial processes, because
yeah.
I could predict the how toxic a chemical would be to the body based on certain in vitro. That means test tube tests, right?
Hmm.
So not to bore you, but really,
No,
I
this is
could,
amazing because I'm such a nerd, by the way.
yeah. So I could measure what we call the binding constant of a chemical to albumin, and based on that, predict the toxicity of the compound, how inert it will be in the body, and based on obviously some enzyme reactions, where we're extracting some enzymes from liver mixes and putting it together with the chemical, we could predict the toxicity. What that meant was that a company like Kodak, they had 80,000 chemicals. Rather than doing what we call rodent and animal studies, we could predict the toxicity in the test tube. And so when I got hired, was really to bring that knowledge from my doctorate into the industry. And literally, we're saving the company $1 million, $2 million per chemical.
Wow.
And so that's a huge contribution to the company. That work was never patented.
Hmm.
And for some reason, I never felt the impetus to patent. But it was something that we did, and it was fun to really be able to shorten the, because to do an animal study, it takes 2 years.
Hmm.
Test tube work is a month. We are done.
And you
So
have
we're
your
doing a lot
results.
of high
You have
throughput
your,
stuff. Yeah.
yeah.
And what that did for me was, it was now at Kodak was when I got introduced to management. And so, really, what corporates do is those big corporations is they really are a university for management. More than it's your first corporate job, but it is also where you learn management and how metric systems work. Which, going back to what we'll be talking about probably later, is when you're managing a startup, right? You do not have employees with that corporate skill set. So part of your job is to try to infuse some of that metrics management into the startup environment, which is a tough job, right? But you know, those corporates are good at it. So I was put on a fast track for leadership, what we call the diamond leadership. Very quickly moved within 9 months. I literally went from entry level scientist to senior management, and was managing a division, the part of the toxicology division at Kodak, and also became the president of the Black Employee Network in the company, literally reporting to the CEO on all matters Black employees. And so that was really an amazing experience, because I was dealing with the brightest leadership minds in the country. Kodak was a
Yeah.
Fortune 500 company at the time, having access to the CEO, Dan Karp, and Mike Molly, who was the vice president for this, actually chief operating officer for Kodak. It was a 21 billion dollar company at the time, or something like that. I mean, so that was really just kind of stuff that's happening at you at a dizzying pace, but all in mind saying, there is a purpose here. I'm being exposed to this not for personal gain, because learn and understand how these systems work. You have a mission to accomplish.
Yeah, no, that's a very, very impressive journey. Kind of like how, I mean, all these opportunities that you got, you really, really did work hard for them. You, you know, um, like you said, you were prepared for when when the opportunity and chance came along, taking you to Sweden, going back to Cameroon, doing studies that are really close to your heart, and then taking again another chance to the US, another new place for you, going into PhD, getting out, being headhunted, and just like you're saying, like life was just moving fast, and then you decide all of a sudden you're leaving all this behind to start this something else on the side, checkups cover. How did that also kind of come about? You're in line for this amazing managerial role, you're top contender, and then checkups. Take us through that.
Actually, I'll give you the short version.
Okay,
The
short version. Thank you.
Yeah, well, so while I was doing the work at Kodak, the CEO one day just literally called me to his office and said, healthcare costs is rising. At the time, Kodak was spending $35 million on 65,000 employees. And the inflationary trend was caught the eye of the CEO, and he said, I need somebody with a medical background to take a look at this. And understanding now my passion that I really wanted to do something above and beyond just the traditional science. So I was assigned to it, literally with a memo, right? And the another occurring trend is that big things don't happen with a lot of talk. One line, do this, and that's what got me from science and clinical care into healthcare benefits. And then I started looking at the healthcare benefits. How is money spent? Right? And long story short, we started analyzing the data, and we saw that certainly we could improve the healthcare outcomes by managing how people are navigated through the healthcare system. And so we started now managing, created programs where we manage how the employees access care. And that work now attracted the attention of Blue Cross and Blue Shield, the Excellus plan, and I got a position to now work at Blue Cross and Blue Shield, and that's how I got into healthcare financing, full kila kitu, as they say, right? Lock, stock, and
You
barrel.
just dived in. Like, I love how you're just finding yourself in situations you're never applying for anything, but people are finding you because of the work. Like your work is almost introducing you into these doors and into these opportunities and to these people as well, which
Yeah,
speaks volume. When you attract things, it's easier, and you're at a better bargaining point and power than if you're the one always trying to claw your way through some of these spaces, especially in foreign spaces. And you know what I mean by that,
yeah,
being African and in Western countries.
yeah. It speaks to really a certain level of resilience, but I think
And
at this point,
excellence,
yeah,
resilience and excellence. We can't leave the excellence out of this equation.
the excellence is absolutely key. One of the things that, again, another lesson, uh, the head of the um, the the senior vice president for health and safety at Kodak, when I joined, he said, "You're new to management. Are you going to learn? And you're going to make mistakes, but remember, there's something I can teach you: integrity." And he said, "Integrity is what is going to propel you." So that also was another lesson that I remember stark. Uh, that in every step, integrity was important. Taking no shortcuts in the matter, and so that's another lesson learned. The When I moved to Blue Cross and Blue Shield, the I also had the attention of the CEO of the company, David Klein, at the time, and I became his mentee, and he really helped me understand healthcare financing in a very. His background was in accounting, and he moved from accounting into healthcare financing. So he really helped me understand, created the opportunities for me to lead projects from the grassroots, and he helped me understand myself. I would say that's one person understand myself. He said, Moka, you understand that, by virtue of your exposure, you attract attention in any room, the boardroom. So it's important for you to learn how to manage that. But the funny thing is, he ended up supporting me going to Harvard. That's how I went to Harvard. To go to the
Mm,
program at Harvard, you needed see letters from three CEOs. The application
wow.
was one thing, but you needed letters of recommendation from three CEOs. And Nancy, I share that with you because as we have many folks in the diaspora, the question becomes: are you building relationships that can give you three letters of recommendations from three CEOs in the country where you are, right? If you are not there, then that tells you the work you need to do. Fortunately, he was able to, thanks to his network, I got three letters from three CEOs in a matter of 2 days. Applied for the program, which was very competitive, one of 23 spots offered every year, and I made it, right? And now I find myself at Harvard studying healthcare financing with the top medical doctors. Those who make it to this program are the guys leading the best hospitals in the US, and some from Europe, some from the Middle East. So I'm like, I mean, this is not, I'm not here by chance. It's not because I'm the smartest from the continent, but it's a duty. And so, long story short, um, as I was sitting in class one day, I heard this NPR news saying the healthcare indicators are going in the wrong direction despite unprecedented spending in global health. I said, how is that possible? Why should we be spending more for worse outcomes, right? And that really got my attention. Ultimately, saying, I think I could, instead of staying in the healthcare financing space in the US, I think my name is being called. And I started looking at the healthcare financing opportunity in Africa. Guess what, Nancy? The
Mm-hmm.
date I decided to leave um, the US, I quit my
Your
corporate
birthday.
career.
Your
What's today?
birthday. 20th December.
No, September 23rd.
Oh, September 23rd. Also September 23rd is my brother's birthday, my
Birthday.
baby brother. Our last one it's his birthday today.
It's his birthday today. So
Yeah.
exactly 14 years ago, or now, yeah, 14 years, that I
Hmm.
said I would be setting sail for the African market. Long story short,
Wow.
I chose Kenya. I chose
Hmm.
rural Kenya to do my
Hmm.
work,
Yeah.
and I have never looked back.
Wow. Wow. So it's from the halls of Harvard that you are like, I'm going back to the continent and I want to take my knowledge, my networks, my experience to the continent with, healthcare financing, and you chose Kenya. I love it. And I've spoken to so many founders and so many entrepreneurs just like yourself who some of them may not even come from Kenya, but they decide to start their work or to kind of like select Kenya as an entry point to the continent. Is there a reason why? I mean, being Kenyan, sometimes you may not even understand the beauty of the country or even the potential and the amazing amenities in the country, because again we're always looking at what's not working instead of what's working. So for you, in a few words, like, why are you seeing so many people over and over again deciding to pick and select Kenya as an entry point to the continent, whether it's a stopover or it's their final destination?
Uh, I have a few friends who say Kenya is a soft landing for getting into the African market. It's even they even put it in a more interesting way, right? Um, well, think about it. At least from my experience, 2011, we're looking at the post Kibaki period. Kenya
Mm,
was at its glory, right?
it was.
Systems were working. By systems working, that means
Can
Kenya
I
was
just add something before you say anything? I don't know how this is going to sound, but in 2010 we had the promulgation of the new constitution in Kenya.
right.
And when that was happening, on I can't remember which date it was, but there was there was a presidential kind of like sitting at is it Uhuru Park? I was one of the children walking walking across the podium with the flags, and I was in black. So the national flag has various colors. So it has black, it has red, it has white, and I was in black. And I remember across the country, children were students and pupils were chosen to walk during the promulgation of the constitution, and I was among them. I was in high school at the time. I was on my fourth form four, which is the final year of high school, and I was among the, I think we were four girls selected to walk that time. And I remember even calling my parents, everybody. That time I didn't even have a phone, so we were using, I think, a teacher's phone. And so I remember, like when you say the glory days, like I remember it as if it was yesterday. I was younger then, but like yeah, I just had to mention that.
No, that's amazing. You know, those are things that we need to draw on because it tells us that there's a certain message that life is sending our way, and we could ignore those. It means that we're sometimes chosen to represent the country in very unique ways, right? Wow, that's amazing. Thanks for sharing.
Yeah, that I to this day I'm like, how did I end up, because it was such a momentous time, right? And it was so random because the promulgation of the constitution was happening, or kind of like the celebration itself was happening in Nairobi. At the time I was in a school in Thika, which is a different county or like district to Nairobi, and somehow I found myself there, and it was really cool. I wouldn't even lie. We were marching. I think for 2 or 3 days. It was like a camp to learn how to march, and we're just like
Oh,
every
wow.
day we wake up and then we learn how to march.
That,
Oh my god! Oh
that's amazing.
yeah.
Yeah, those memories.
So it's
Yeah,
2020, 2011. There's this positive energy about the country.
country. It was unbelievable, right?
Hmm.
Kenya was a country with that had a stable currency. The Kenya shilling was strong. The export processes were clear. The Kenya Airways in and out of the JKIA was unprecedentedly relatively easy compared to other countries. Access to visa was not a question. That was something you sent your passport to DC and you got the visa back in 3 days. I mean, just those things that were working, right? So then also Barack Obama was president in the US at the time, right?
Oh yes.
So those of us were like, we got to go back and hold the fort for our brother back home, right? So it
So
was
there was just so many things happening at the
exactly
same time. And then
right.
on top of that, Barack Obama had also roots to Kenya.
Yes. So that was the romance of this whole thing, right?
You were
Because
taken by everything
Ye-
happening, doctor.
exactly, right? So it was, there were not too many options. Obviously, we looked at South Africa, Nigeria, Uganda, Cameroon, uh, Ethiopia, but Kenya was it, right? It was a very defining moment in the Kenya economy because think about it. That is when the infrastructure projects were happening at a frenzy pace. The road from Onwayaki Way through Riverside Road was being tarred. I remember that. Right now, you won't think of Nairobi. Nairobi was from Riverside Drive all the way to Oletoktok down to Yaya was a mud road
Wow.
with a bridge.
Really?
Yes,
Oh,
Wayaki Way in front was a dirt road all
true.
the way to the roundabout where there's a church next to the National Museum, right?
Mm, yeah.
The going up Wayaki Way was not a pretty ride. Uh, the You had to have 4 or 5 taxi drivers whom you had their phone numbers, and you'd call, and you see which one can pick you up. If not, you pick up the sixth one to get to where you needed to go to.
There was no thicker highway because I
Those
remember that it's the time it was being built. Because
bells.
I remember it was just a mess. Like that road was a mess because I was commuting from Nairobi to Thika for high school, and that's around the time it was being built.
So that was a renaissance going on, right? And so it attracted a lot of persons like myself who believed in a promise for Africa that we could see unfold. Obviously, again, as I said, we are all romanticized in a way, hoping that one day Barack Obama would hear about our work in his home country and say, "Hey, guys, I really appreciate the work you're doing as folks in the diaspora back home." But here we are, we're still pushing, right? And on a more applied note, Kenya had the best in terms of one of the private healthcare systems in terms of not on the delivery side, but in terms of healthcare financing. Kenya is still and was obviously at the time one of the most advanced in terms of healthcare financing. South Africa is advanced with private financing, but it is quite centrally funded, very similar to the US system, very deep government involvement in private insurance. So that was not quite the case. Nigeria, there was no private insurance even being discussed at the time, or it was very limited. And obviously, Uganda was all USAID money. So it was really HIV/AIDS work happening there. So Kenya just was a natural, really a natural fit, and certainly took advantage of that.
Amazing, amazing. I think it does show you how when government policies are working or people are kind of like doing what they say they will, it attracts so much investment from the from the private sector and investment from outside of the country. I did economics and statistics back in uni, so just the whole understanding of the economy and the different players, and as much as we'd like government not to be involved, there's some underlying central and key things that needs to be working so that people can actually be like, yes, I'm able to invest my money and my hard work into a particular economy. And like the way you're mentioning, you looked at various other economies or various other countries, and you're like, okay, for whatever we want to do, this might not work in this region, this might not work in this region, but then ended up selling with Kenya. Again, I think also that was probably the reason why I picked economics and statistics because I was like, I
Exactly.
love everything that was going on at the time. But yeah, so tell us about how checkups cover kind of came about, and how I know it's very different from your usual traditional healthcare insurance kind of model, or in healthcare financing, and also go into the topic about how healthcare, I think, as a whole, the way people look at it is they might look at it from the very end, which is like the interaction between an individual and the hospital, but that's not healthcare. Healthcare starts from very early on, and I think which is something checkups, are doing. So I'm very, I know the story about checkups and I know everything that you guys are doing, but it would be great for people to kind of hear that as well.
Sure. Let's build on the economic conversation for a while, right?
Mm-hmm.
Because I like the way the conversation is really flowing. If you think about it, right, back then compared to now, and how it would be, there is a very fundamental change that is happening not only in Kenya but across sub-Saharan Africa. But Kenya being an epicenter for that manifestation, which is that the economy is very rapidly moving towards a credit and debt economy, which which people are living. We see it in the papers, but I don't think it is sinking in. Let me repeat: the average person now is living on debt. Businesses are functioning on debt. Every car on the road is a manifestation of debt, either because there is a bank loan on it or there is a logbook credit against it. You won't believe it. Every house that is coming up is a manifestation of debt. Now, so we come from that period whereby debt was not high to now an era where debt is high. That's an important point. We're also coming from an era whereby healthcare was a national thing, right? You went to the public hospital. But the public hospitals functioned based on certain fundamental market forces. One is that the salaries of healthcare professionals were suppressed. Doctors underpaid, nurses grossly underpaid. Nurse is one of the worst paying jobs you can think of compared to their responsibility. Doctors the same. Administrators of hospitals were underpaid back in 2010, 2011 and before. The cost of real estate was low. Cost of energy was low. Supplies were coming in 30% subsidized by donor money. All of that gone. You now have a healthcare system where doctors want to be paid properly, nurses want to be paid. Real estate cost of a house of an office in Nairobi is $1,000, $2,000 a month. So the opportunity to offer service for free is gone. And that is why the even the national healthcare system is a difficult problem to solve, because one is the cost of delivering care because of the administrative cost is very high. By the time you pay the CEO and the CFO and the administration of a proper hospital, that is already 22 million, 2 million, 3 million, 5 million, 10 million shillings, just administration. These are not people seeing patients. Where does that 10 million shilling go? It goes into the cost of medication, into the cost of labs, into the cost of diagnostics, and the cost of consultation. Now, because people look at consultation as a face value, so if I say, oh, the consultation is 2,000, people say, oh, I'm not willing to. So that cost is buried obviously in other areas. So if we embrace the fundamental shift in the economy that healthcare has, the sphinx has risen, and the cost of delivering care is very high, and the cost is even higher in the hospital systems, then the question becomes, what the heck are we doing thinking that we can finance it with charity in a market whereby the average person is functioning on debt, in a market that we also know that less than 5% of people can afford premiums? I don't know. I mean, I ask folks, how many do you have insurance? Yes. Who gave insurance? My employer. What is it now? Employers are giving micro insurance, but you must be part of the high-end Fortune 5, the high-end employers in Kenya, primarily in Nairobi, to have private insurance. Now, if we look at it and say, okay, if we must have a system that addresses the need, can we sit and wait for some magic to happen? The tax basis, now the government is taxing at 2.75%. You'd have to be clipping at 10% to fund the current system. You have to be taking 10%. Certainly, that is a non-starter. 2.75% is affecting people's salaries and livelihood. So there is something has to happen. And so if you look at what we are doing from that perspective, it is actually, Nancy, I'd like to submit to you that it's quite revolutionary, that we are positioning ourselves and saying, how do we enable microcredits to work in a healthcare system? Now, if you go now and take a credit from your bank or from a financial institution or borrow from friends and family, and then now you take that hard-earned borrowed money and deploy in a high-cost environment, which is going to support 65% of administrative costs, leaving you with very little towards the cost of goods, you have had a raw deal, I'm afraid. You're going to pay interest on the one hand from a very bad interest, and you're going to pay for service at a very bad rate. So you kind of have a double loss. And that means that if you have hypertension where your monthly bill is $100, right? And we know that the market having $1,000 per month is not everybody who has it. Let's give that as the average salary is $1,500 a month. Every month you have to pay rent $500. You have to pay some school fees or stuff, food in the house $400. Let's say you spend $10 at $300. The taxes take 25-30%. So you're left with $300. And that $300, 100 has to go to medication. That's what we're talking about here, right? So the question becomes, you take that $100 and then it's misused because of the cost structure. So once as we understand that healthcare and financing are certainly bedfellows, not running on the same different track, we got to first of all get people in the space and saying, how are you using your money? Next is, if you cannot afford the premium, which I have another conversation about that, but if you cannot afford premium, which is sort of the status quo, what alternative do you have? And so we have the enormity of responsibility as a business to not only create a product, but to educate the market around how efficient is their dollar being used towards healthcare. And so what we have created is a mechanism whereby for every dollar you put in our platform, you get 4x the market value. And we get enable to give you that 4x by removing the overhead that is associated with traditional healthcare delivery in a very deliberate way. And we do that by converting a prepaid amount into ingredients, which allows us to transform the ingredients into a service for you on demand via WhatsApp. It's a very fundamental shift. So think about it as Nancy has a couple of options. Her
Mm-hmm.
options are, she walks into a hospital where the food has been pre-cooked. It's on a shelf. That is like going to shop every day in the supermarket or in a top tier restaurant where the food has been pre-cooked, priced on a menu. That is one way to shop for help for your groceries. Or you could call the farmers and say, hey, farmers, I'm going to pay you some money every month, but you send me the goods. And then if you go to this kitchen, that goes, and then the food is delivered to me. In that process, you're saving 4 times the cost of healthcare. Same thing, same stuff. And so that's what we have done with Cover, creating this platform which people can trade benefits. It allows us to buy the ingredients for you. And then when you're sick, you just send a WhatsApp message.
I love
Uh,
that. It's super accessible, and WhatsApp is so accessible everywhere in the country.
yeah. And now, if you don't have money, we enable you contact a microfinance or a bank to give you that credit because we understand we're in a credit market
Yeah.
to make it happen, right?
Yeah. And I think it's a lifeline for so many people. Because I mean, how many times have you found yourself in a WhatsApp group, people trying to contribute money because somebody's in hospital and they're not able to, cater for some of those big bills. So in terms of like checkups cover, what are some of the products, and maybe take us through the customer journey. I want a service, or I'm looking at exploring various healthcare services. What's the first point, and what are some of the options available? We know, you're going to get it to make it cheaper. You're able to get 4 times the value of any other products or services out there. But like, as a customer, I'm coming and I want to explore. Take us through like the customer journey.
Great. You have a medical need. Let's say you have a cough and cold,
Yes.
right? And the options are to go to the hospital, sit there, wait, see the doctor. You get a
Yes.
prescription. You first of all pay the consultation fee. You see the doctor. You come back. He says, I need you to do these labs. You go back to the counter. You pay for the labs. Then you go get the labs. The results are out the next day or in the evening. Then you call the doctor. Then he says, you know what, Nancy, this is your prescription. You go now to the pharmacy. That is
Yes.
your default option,
Correct.
right? Now, two things are happening in that instance. The first thing is that all you do is, I know where to go physically. The second thing is, I don't know what I'm going to get. So I'm just going to put money in my wallet and go there,
Yes.
right? That's
Whatever
the
happens, happens.
whatever
You get
happens, happens.
quotes. Yeah.
Yeah. right? Now, with cover, all you do, and you don't wait for when you're sick, but in case you're sick, you go online to the cover website or you text via WhatsApp 0111050 and you buy benefits. You say, I by putting 5,000 shillings, unlock 10,000 shillings of benefits. No, actually, you put 5,000, you unlock 20,000 shillings of benefits. And when you unlock the 20,000 shillings of benefits, you have 5,700 or so for consultation, 7,000 for labs worth of benefits, 5,000 for diagnostics, so that's X-ray, ultrasound, and 2,000 for medication. So you don't know what the doctor would need, but you know that you have unlocked benefits sufficient that for the average condition already you are punching many levels than the average person. Now, once you have those benefits, you just text and book an appointment. The doctor will call you in 5 minutes and say, "How can I help you? I'm having this cough, my chest is paining, it's stuff, I'm not sure what to do." The guy is like, "Great. Well, let me send the nurse to come do your symptoms. Is that okay?" "Yes." "Where are you?" "Okay, the nurse will be there in 2 hours."
Okay, so just for clarification, the doctor, you're having this conversation virtually.
Yes,
Okay.
just as we're having a great conversation. Nothing different between what we'd have for 90% of the conversations. It's a medicine is about, first of all, communicating and understanding the person's pain. That happens. Now we say we need your temperature, we need your blood pressure, we need your weight, your height. We say that's important for me as a doctor. Are you okay if we send the nurse? Yes. The nurse will be there shortly. Then the nurse comes in, takes your vitals, and sends back the information. And the doctor sees and says, "Okay, well, based on all this, these are antibiotics. These are the test results. The nurse also took your blood work, and we ran the test, and these are the results. And these are the medication. We sent somebody to deliver to you."
Wow.
All of that happening from the comfort of your home, and you are leveraging. And what you did when you paid the 5,000, you bought the ingredients.
And time, your time back as well. I don't
Yep.
think you've mentioned about time, because
Right.
sometimes it can take 2, 3, 5 days to get all this together.
All this together. The first day is to look for money, or you go there, you sit, you lose time, you come back, then you look for money, then you go back. And the inefficiencies of the system, and you have to go back each time to get your results. You have to go back to pick up your medication. You have to go back, right? So that convenience is very important because if you are not doing your work, you are not earning,
True.
right? And that earning is what allows you to function in society, right? So we are addressing that indirectly, but the fundamental thing is that when you buy benefits, you trade benefits, then you are now buying healthcare at the lowest denominator possible. So what does that mean? Is that if, let's say, I need to do a malaria test, when you buy benefits, you are buying the malaria kit. You're not buying the test results. When you go to a regular, you're buying test results. Test results will be $6 for a malaria test. When you buy the kit, you're buying the kit through us, and we run the test for you for a fraction of the cost. That is how we are trading benefits, right? And so we have digitized the process, tokenized the process, to make sure that we have real-time reconciliation between what you need, what the benefits we're deducting from your system, and the provider we need to pay. And that means we can pay our providers in real time. With that equation, I think we leave everybody kind of happy, where you've had a great service
Yeah.
at the best price possible in the market, because healthcare cannot be cheaper than cost of goods. Uh, your time has been well spent because literally you're on the phone. You may
Mm,
feel sometimes there are delays. You certainly want it to come fast, but that we manage with communication, and you feel better.
true. True. And I think the element, because my first interaction with telemedicine, or kind of like an aspect of it, was when I moved to London, and there was I was able to kind of like access doctors virtually and over video. If like I'm not feeling well, I'm done with the flu, I would have a call with them, and from their conversation or from the consultation, then they'll be like, okay, cool, I think you need to go and get your vitals checked, or you just need to rest, or maybe you just need to take some over the counter medication. And even apart from that, even with well-being, so I don't know whether your platform does that, but even with well-being, things like therapy, you're able to kind of access a therapist virtually. I've had therapists virtually. Again, it saves a lot of time, and you're able to again access the services that you need. So yeah, I think it's amazing what's happening in that space. I'm quite excited with the health tech as well. My baby brother, whose birthday is today, is actually doing pharmacy. He's actually turning 22. I'm calling him baby brother, but he's a grown man.
That's a good one. Happy birthday to him.
Yeah, he's called Tony. So
Tony.
I think
Happy birthday, Tony.
I'd love for you also to just explore briefly, and I know because of time, I'm very cognizant of the time, but like briefly, I want you to also mention how the different players in the market, how this does differ. Because I don't know whether some of the insurance providers, I don't know whether you can even call checkups cover an insurance service. I think it's almost more than that. But I'd want you to just share briefly the differences of that.
Yeah. So the consumer is has obviously choices.
Yeah,
When you buy insurance, which is one way we contrast ourselves, is you're paying against risk, right? And the actuarial model from an insurance perspective is that how much are you likely to spend in the network? Now, when you buy insurance, first of all, the insurance product is priced based on the cost of service, so it would only go up as salaries go up. So the premiums that you are buying is to make sure that doctors are paid better over time. The raw materials will not really drive your cost. It is the overhead. So you make a conscious choice. I want to be paying this product that over time pays a lot of doctors good fees. And I'm a doctor. That is a great option. Please, the more people who can sign up for that. But it is at a point whereby now the average premium is $1,500 to
true,
$2,000,
true.
right? How many companies can afford that? Not too many. That's a fact. Less than one out of 10 small businesses can afford any form of insurance for their staff. And if that's the backbone of the economy, then the question becomes what else? Now, so the point I'm making is that insurance sells you this product, which is pegged on very high admin cost, and their job is to keep you out. Their fundamental job of an insurance product is that you sell it to 100 people, 20 use it, and 80% do not. So you have to design systems so that 80% do not use that product. That is a good insurer. If you put me on the insurance side, I'm going to kill it because I'll do everything to keep 80% away. I'll camouflage it, but that is my objective. Now, insurance is a product whereby, let me break it down for the audience. Out of you have a dollar bill, 20% goes to the broker, or let's say 12%, 15% goes to the broker. That is just to reach you. The other 10% to 23%, depending on how efficient the management is just the management of the insurer. So that means your first 33% is just overhead. On the insurance side, it has nothing to do with your care. Some of the other dollars then now is used to pay underwrite risk. Inpatient risk, it's a very low risk because less than 5% of a population is admitted a year. You have no ambition to sleep in a hospital this coming year, so they hope that yes. So they'll sell you a very nice package under inpatient, and you would say like I paid $1,000 and I got $10 million of insurance, most of which is inpatient. Outpatient benefits is your cash, the balance of your cash. So they tailor your outpatient benefits. So they say, okay, you can see the doctor up to this amount. And once as you exhaust your outpatient, you are done. That's it. So now, uh, that means that they have to put age limits. They have to exclude for pre-existing conditions. There are waiting periods. So if you're an individual, you get care, you would have to wait for 6 months. I'm breaking it down because many people do not understand what insurance is. It is a one size fits none solution, which is designed to exclude by structure of the product. Now, so the major differentiation is that when you trade benefits, use your benefits do not expire. There's no age limit, no exclusions for pre-existing conditions, no waiting period. All of those is that your money goes, the same dollar you're spending is going into effect. Our customer acquisition is happening through banks or through individuals. So we're not spending that 20% of your money to acquire. Everything you go on the website comes back to you in terms of healthcare. So you're
Wow.
so literally we are using every dollar more efficiently than in the insurance model. Again, I respect insurance companies, they have their role in underwriting risk, but in terms of buying direct care, certainly you want to think about it differently. So no
Mm.
age limits, no exclusions for pre-existing conditions. You can add your parents, you can share your benefits, and it's more reflective of the African style. Because I'm pretty sure that you sit in London and your biggest preoccupation is that if my mother is sick, I want to be there for her.
I'll take the next flight back home. Yeah.
You take the next flight back home, right? And
Yeah.
so uh, now you want some basic cover that says if she's sick, she and cannot be reached because I'm on an interview like this, she can get care.
True.
There's no reason for her to delay. So I'm
True.
going to buy $100 of benefits. She would have $40. And by the way, your brother can be a dependent. Everybody in your family can depend. Guys, when you need anything, just text and you get the service. And if it's not, you top up. So it's creating transparency for you. It is giving you a sense of control, and you can invest in giving cover to family back home without any worry about the price exposure, without any worry about quality, without any worry about inconvenience. That is what we are offering the market.
That's
And
amazing.
and if we do that, then really the diaspora should be like all over this product, in my opinion.
That's what I was
All
actually
over this
about to
product.
say. Like, how can also the diaspora, especially people who are supporting families, and also a lot of the diaspora, are very rooted back home because people, nowadays work virtually. They're able to work from wherever. We are seeing a lot of, immigration policies changing. So we might see a wave of people moving back. So how can people in the diaspora, and I think I mentioned how the last time we met it was in London, but how can like also like the diaspora people kind of like explore this product?
It's I mean, I say with a lot of passion, and I'm going to repeat it with a lot of passion. Folks, your dollar, you work hard for it. We know what a pound or a dollar means. It is not a joke. To take that and then it goes into a healthcare system that is inefficient, to me, borders on insanity in the worst case scenario or criminal. Take your benefits, buy your benefits for your parents. We would guarantee already on the medication side, they are going to save 20% on the cost of a tablet. That alone is enough. If they, just one good reason is that on medication alone they'll be saving. Now, if you go and buy medication directly from outpatient, that's fine. Again, the market is a choice. But if you use the cover platform, not only are you saving, but for every dollar, even if you buy just the what you call the Medicare plan, you're getting 2x the value. It
Mm,
unlocks consultation, it unlocks labs. Many people are just treated without the labs and the diagnosis properly done. And that to me is not okay. So I would say that literally, let us get into the modern era and say we can shop. We have gone online for Amazon with our shopping. We have gone online for our food, And we can also now go online for healthcare. It is safe, it is secure, it is reliable, it works. It is working for over now close to 100,000 people, and
Wow.
certainly we need 1 million people.
We need a million, Doc. We need a million.
Million.
And just to add on to that, like where are you live? So is it like the whole of Kenya, or are there particular regions in Kenya that you're live? I know you also are live in South Sudan. Maybe a few expansions in the works. I don't know, maybe.
Yeah, well, the we're very excited about this,
Hmm.
and so we're looking at obviously expansion, but not in the immediate future. We
Okay.
want to really make sure that we drill down to the excellence to the Kenya market and obviously the South Sudan market.
Yeah.
So it's accessible throughout Kenya, right? It's just a matter of where is the parent, where do
Hmm.
they reside, and then we make sure that we can dispatch the medication to them.
Okay.
G4S
So it's
reaches
it's
almost
not
all
just in
corners,
Nairobi. So it's
not
available
just
in
in Nairobi.
Nairobi, Kisumu, Mombasa.
Yeah.
Okay.
Everywhere. Right now, we're working in partnership with the Dutch government. They're
Hmm.
actually doing a site visit as we speak today,
Nice.
um, to assess the operations. But they want us to recruit 800 nurses.
This is reminding me of how healthcare used to be back in the days, where it was very community centric. I don't know whether you experienced that, but like I remember how back in the day, even like local dispensaries, and even like back home, if somebody is if a woman was pregnant, a mother had children, they'd have like, people coming in to check on them. It was very, very community based. It does remind me of that. I don't know, I could be wrong, but it does remind me of that.
Absolutely. Uh, Healthcare is one of those things that there's a direct and indirect cost. The
Mm-hmm.
indirect cost is who can assist you, right? Once you go into the hospital, the number of people, each person that comes to visit, is a cost. Not only social cost, but real cost. Somebody's leaving their work to come to you. And when they come in, they have to buy food and bring to you, and then your bill has to be paid. And that's why those WhatsApp groups are being formed to support people in the hospitals.
Yeah.
But here's the sad part: a lot of those things that are happening to people in the hospital can be prevented. Many people go. The reasons for for admission are not cancer per se. I mean, that's one of it that happens. But the reason: hypertension, diabetes, gastroenteritis, and chest infections that were not treated quickly. So we could cut back a lot of those hospital visits through early diagnosis and treatment at home. And if it's cancer, if people are having their annual checkups, a lot of these cancers will be arrested at the early stage before they get too far. So the ripple effect over time is important,
Yeah.
and we'll stop addressing the catastrophic claims. Oh, well, they have been diagnosed with cancer, so let's contribute 2 million is the bill. What happened 6 months ago? That's a question I ask. Each time I see that group, I say, what happened 6 months ago? Nobody answers. Well, we are struggling right now. The family is in debt. We have sold land. It's like, well, everybody has their strength. Certainly, we're not in crisis management. So,
Yeah.
really, our appeal is to the the market, but really anyone who has a good sense of their dollar to really rethink how they're spending that money.
Yeah. No, I think that's fantastic. I think that's also a great place to sort of end our discussion. I think we need to have you back again because there's so many things I wanted us to discuss, but also conscious of your time. And as we close, I want to do another quick fire round. Because we've had like amazing discussion, but just to kind of like leave it at a lighter point. And the first question is one healthcare tech trend in Africa you believe everybody should watch, apart from already what you're doing in health financing.
uh the tech trend that everybody is home-based care. That is just where it is going, so I
Hmm.
can't shy away from that.
Yeah.
They certainly uh there's just so much happening in that
Mm-hmm.
space. The all
Yeah, I
kinds
think
of
the home-based care is really important, and also just bringing tech into it with the, telemedicine. I think for me, that makes so much sense in terms of like time saving and even just how accessible doctors become. And even that brings in the element of different ways of working for doctors, such that you're not just tied to a hospital. You can be able to work remotely, and with various ways, and you're also able to see numerous people at the same time. So
well,
it's, I think there's a benefit both ends, for the client, for the patient, and also for the doctor, or rather for the health system.
yeah, believe it or not, in another 3 years, the largest provider of healthcare in the world will be Amazon.
Really?
It's
How
already
so?
happening.
Mm-hmm.
Well, if you go to Amazon and you go to the very top, you see Amazon Care Plan. You pay $200, you subscribe, and
Let
they
me
deliver your
see.
medicines. They send a lab to you. You can talk to the doctor, and it's Amazon One Medical Plan in the US and in Europe, I think, but
Okay, in
definitely
the
the US.
US for sure. In the UK, I am not too sure about it because I'm just looking at my Amazon right now. Or
Well,
maybe I'm the one who doesn't have it.
yeah. Actually, many people with they're kind of optimizing their supply chain, right?
Mm,
Whereby, at least in the US now, they have their lab services, they have their pharmacy
wow.
services, and they have their remote doctor services.
That's
To
incredible.
see a primary care doctor takes 2 months. With Amazon, is 2 minutes.
Yeah. Yeah, and healthcare system is getting quite, there's a lot, even in the UK with NHS, there's a huge burden in terms of how many people they're able to see, the wait times, even for some critical illnesses, you're not able to get immediate healthcare. So I think this is the trend, this is the way things are going, and I think it's for the better for everybody as well. And even with like the primary healthcare community, well-being as well, it takes a lot, and I think it's a move in the right direction, and it's for the betterment of everybody to have less and less people in the hospital, because again, people in the hospital also cause other instances. That's where diseases are kind of like passed, especially communicable things. The flu season, you don't want to be in a hospital.
Exactly. I have a prediction,
Uh-huh.
Nancy. In another 5 years,
Mm-hmm.
Tony will be working for Amazon as a pharmacist.
Yeah. Yeah, I think so. I think so. We've
Oh,
we've talked a lot about like his path in terms of career, and he loves tech, and but he also loves like pharmacy, and I was trying to tell him like there's a lot of opportunities for him in the health tech space, and yeah, I wouldn't be shocked if he finds
yeah,
himself
it will be the
working
biggest
for
employer
Amazon.
in healthcare.
Yeah.
Decentralized healthcare is going to be managed at the scale of
Mm-hmm.
the Amazons of the world,
Yeah.
because time, logistics would governs every major system right now, right?
Yeah. And that also brings down the cost, I'm assuming. I'm hoping.
Exactly. Alternatively, the alternative would be a super mall for healthcare,
Mm.
right? But that is yet to be built, right?
Mm-hmm. Yeah.
But
Okay.
that's kind of where we're going.
Okay, cool. Next question. I think this we might have already mentioned because I think we talked about mentoring earlier on, but what's the best leadership lesson you've learned on your entrepreneurial journey?
Focus on the customer.
Focus on the customer. I agree. Everybody says you need to understand your customer through and through. If you get your customer right, you're good. If you don't, hmm,
Yeah. Very,
awesome.
very few. It's easier said than done.
It is.
Yeah.
Okay.
And it's something that we have to remind ourselves every day.
Okay, I have another question. One piece of advice you would give to young African doctors considering entrepreneurship? Because it's not very easy. Because entrepreneurship, I feel like you can't even go to school to become a good entrepreneur. You have to be like in the ring. But like, hey, um, piece of advice you'd give to young African doctors considering entrepreneurship?
Uh, First advice: do not resist entrepreneurship, because every profession now requires you to be an entrepreneur. Lawyer, teacher, educator, pastor, you need to be an entrepreneur. So entrepreneurship and career options are no longer dissociated.
Mm-hmm.
Second is that the sooner you start, the better, because only time is what shapes. It's taken us 14 years to get to this point where now we have a very scalable product. So do not waste time. Everything else you learn, like everybody else, some will learn faster than others, but you have to learn and convert your idea into a solution that solves a real problem. And the last bit of the equation, especially for those who see themselves as high end professionals, understand the value of your service so you can price it properly. The
Great.
African problem is also a pricing problem.
True. True. Okay. I like asking this question to almost everybody that comes to this live session. So, a book, podcast, or resource, in your case, all those different journals that has deeply influenced your approach to healthcare or even business.
Ooh, they quite a good number. Uh, I would say for me,
Yes.
the case studies at Harvard are defining,
Mm-hmm.
uh, and I do continue to support case studies. And my mentor at Harvard, Rick Segrest, he started multiple companies, and he understands how to quickly convert a problem into a solution that is scalable. And so I would say that has been the biggest influence. But certainly, anyone, if you can lay your hands on a case study,
Mm.
you learn more than any book can tell you conceptually.
True. There's this book I've been reading. Well, I've read. It's written in a very scientific sort of way, and I don't know if I can find it, but it was talking about friendships and how we use the word friend very very loosely. I can't remember. I think it's somewhere in one of my bookshelf, but it's about friends and the circle of friends, and it was talking about you can't just be calling everybody your friend, and even in terms of your friend, there's only a certain number of friends you can have at any given time. And the book was talking about having the ideal number is 150, like you have the capacity to grasp 150 friendships. And the 150 friendship, not everybody, your relationship with them is not the same. So you have like close friends, you have like family, you have like, it goes at length, kind of like explaining. And it was such a freeing moment for me because I run a network and I know so many people. But also at the same time, my relationships with these people, it can be very confusing for me and for them. And so the book really gave me so much almost freedom in that, yes, I may know a lot of people. Yes, a lot of people might know me. But then I also have to be mindful of my close friends and be very conscious and intentional with building these friendships. And even I think at some point with my contacts, I would only have like maybe 200 contacts saved, and anytime I can't remember who somebody is, I would just delete the number. I don't tell anybody, but I'll just delete. And so sometimes when somebody calls me and I'm like, who's this? Because again, probably it's just a personality thing, but having too many contacts is just so overwhelming for me. So I found that book to be very helpful for me in terms of even just navigating the friendships and networks I had while building Jasiri. But yeah, I guess for you the studies and case journals.
Yeah. There's a book which also is very good, The Numerati. Numerati was published a while back, but really
Mm-hmm.
it just came out after the Barack Obama one, but it analyzes the probability of certain events happening, right? And really separates the noise from the signal in the market. And it gives very good examples of how to understand where your customer is at any given time to increase your opportunities for engaging the customer. It's something which we uh, in the entrepreneurial side need to really get better at. I am speaking for myself to understand where is your customer and what will make them move like now, what will make my customer move today, right? I don't know what that is. What would be in his sphere of influence that will make him want to click yes or no. So it's a very good book from a business operations perspective.
Yeah, no, that's amazing. I think with that, we end this session. It's been a very, very fantastic time to have this conversation with you. I'm always learning something new every time I talk with Dr. Moka. For everybody listening in, check out CheckUps COVA. You can find CheckUps COVA anywhere on the internet. So you can find it on the internet. Just type in CheckUps COVA. You can also find them on various social media platforms. You can also find Dr. Moka on different social media platforms. You can find some of his case studies as well on the internet, across the various institutions and, during the various years that he's done a lot of the publications. You can follow myself as well, Nancy Masila, across the social media platforms on the internet. Check out Jasiri Network as well across all the platforms. It's been a pleasure. I love talking about healthcare. I love talking about healthcare, especially when it comes to financing and how that affects the economy. Hopefully, I get to see you again. I get to speak to Dr. Moka soon. If you have any question, please feel free to type it out in the comment section and we'll get Dr. Moka to respond. Other than that, it's been a pleasure and see you on the next one.
It's been a pleasure. Thanks, Nancy.
Thank you.
Bye now.